Perform a scene survey and make sure everyone is safe. Ask what happened to learn the history of the incident. Identify yourself as a first aider and offer assistance. Make the casualty comfortable and perform a primary survey. Airway and breathing are easy to check by asking where it hurts, but check for shock by checking the skin condition and temperature, and do a rapid body survey to ensure that there are no other serious injuries. The casualty will support and immobilize their injury. Expose the injury and examine the area. The casualty will try to support the weight of the arm to lessen the pain. A fracture may show bruising, swelling, and an abnormal shape to the bone. A shoulder dislocation may show deformity at the joint. Compare the area to the uninjured arm. Is there tenderness at the site and pain when the arm is moved? If a fracture or dislocation is suspected, the casualty requires medical attention. If an ambulance is coming, provide ongoing care. The casualty will support and immobilize their injury. If you must move the casualty, then the injury must be immobilized to prevent further injury. First aiders should consider transporting a casualty only if the injury is not life-threatening, when the first aider is a family member, transportation is not a risk for the casualty and the first aider, and medical help is delayed or cannot be reached. Perform a modified secondary survey. Take a sample history and record a baseline set of vitals. When a collarbone injury is the casualty's only complaint, and when other injuries are not suspected, examine the arm from top to bottom to determine the fracture site. Check the distal circulation by comparing the temperature and color of the fingers on the injured side with the uninjured side. If the elbow can be bent, bring the hand on the injured side up to the uninjured shoulder and use a St. John tubular sling to transfer the weight of the arm from the injured side to the other. Place the triangular bandage over the arm, with the point extending past the elbow. Tuck the base of the bandage under the full extent of the arm from fingertips to the elbow, and gather the bandage at the elbow and twist it toward the back to form a pocket for the arm. Pass the end of the bandage around the casualty's back between the shoulder blades. Tie off the knot in the hollow above the collarbone on the uninjured side. Place padding under the knot if available. Secure the arm to the chest with broad bandages to prevent movement of the shoulder joint. Padding may be placed under the knot for comfort and under the arm to hold it in the proper position if required. For a shoulder dislocation, a second bandage can help secure the arm. If the elbow cannot be bent, then support the arm with bandages and padding in the most comfortable position. Check the distal circulation again by comparing the temperature and color of the fingers on the injured side with the uninjured side. Take a second set of vitals and check again for shock. If it is still safe to do so, the casualty may now be taken to medical aid.